Hello, everyone, and welcome. You're watching Eagle News America. I am Eliza Gonzalez Manglikmot, coming to you from Washington, D.C. It is Monday, the third day of May 2021. Tonight, we have updates from several of our correspondents across the United States. Myla Simbulan in Swarthmore, Pennsylvania.
$132.5 billion annual economic impact for Pennsylvania's agriculture.
Mayan Manzano Guerzon in Sicklerville, New Jersey.
New Jersey to ease more COVID-19 restrictions.
Rose Papa Angeles in Washington reports about the district encouraging local businesses to apply for restaurant revitalization fund and urging residents to buy local. We have with us tonight Arlene Ocampo in Fort Washington, Maryland.
Maryland lifts several pandemic restrictions, plus drive-thru and no-appointment COVID vaccinations are offered in-state.
N.Korea in Las Vegas, Nevada joins us this evening.
North Las Vegas ramps up efforts to reach under-vaccinated communities.
Reporting live, AJ Rayo Tutar in Panorama City, California.
Los Angeles offers walk-up and appointment-free COVID vaccination options.
Plus, for tonight's roundtable, stories about pedal pushing around our neighborhoods for National Bike Month. Our coverage begins now. During a press conference in London, Secretary of State Antony Blinken and British Foreign Secretary Dominic Raab addressed the issues of denuclearization in North Korea. Take a look.
And so we'll look to see not only what North Korea says, but what it actually does in the coming days and months. But we have, I think, a very clear policy that centers on diplomacy, and it is, I think, up to North Korea to decide whether it wants to engage or not on that basis.
Blinken asks North Korea to embrace diplomacy as he briefs allies on a new U.S. strategy that stresses low-key progress. In London, for the first time, in-person Group of 7 meeting in 2 years, Blinken consults his counterparts from Japan and South Korea on President Joe Biden's new policy approach, which has already been denounced by Pyongyang. Blinken and Raab also addressed the political crisis in Myanmar.
Equally, we've been engaged with the partners of the region. I've been discussing that with ASEAN foreign ministers recently, and we've obviously got the opportunity with the G7 guests here from Korea, from India, from Australia, but also the foreign minister from Brunei, chair of the of ASEAN at the moment, to discuss how we shift the dial and get a change for the better in Myanmar. And so we'll keep up all of those efforts on the sanctions side, but also on the diplomacy front.
On the withdrawal of troops in Afghanistan, Blinken says the U.S. is not disengaging in a sense that it intends to be part of advancing negotiations for a political agreement between Afghanistan, the Taliban, and other parties involved.
We've also been clear that even as our forces are drawing down and pulling out of Afghanistan, we are not withdrawing. We are not disengaging. We intend to be very active diplomatically in terms of trying to advance negotiations and a political settlement between the government of Afghanistan, the Taliban, and other key parties.
In other news, Iran denies media reports suggesting a prisoner swap deal with the United States in parallel with nuclear talks involving the two arch rivals. Foreign Ministry spokesman Saeed Khatibzadeh in a news conference says the reports from informed sources are not confirmed, as it was said in the past. But without elaborating, he adds that there are always plans and ideas to be pursued. His comments come after outlets including Iranian state television on Sunday quoted an informed source saying that Tehran and Washington would swap prisoners. The source reportedly said, quote, under pressure from the U.S. Congress and the need for immediate results in the nuclear file, the Americans agreed to pay $7 million and release 4 Iranians in exchange for 4 American spies. A senior White House official had also denied the report on Sunday. White House Chief of Staff Ron Klain says on CBS's Face the Nation there is no agreement to release these 4 Americans. He says we're working very hard to get them released, and so far there is no agreement to bring these 4 Americans home. Iran state broadcaster also reports that British-Iranian dual national Nazanin Zaghari Radcliffe, who has been held in the country since 2016, would be freed. But British officials play down that report. The reports come as Iran takes part in talks with world powers over reviving the 2015 deal over its nuclear program. On Saturday, negotiators meeting in the Austrian capital Vienna expressed cautious and growing optimism for a solution. The agreement, which curbs Iran's nuclear program in exchange for sanctions relief, has been on life support since the then U.S. President Donald Trump withdrew in 2018. Khatibzadeh says the issue of prisoners has and always will be a humanitarian one and figures on Iran's agenda regardless of any negotiations. Iran and the United States have had no diplomatic relations since 1980, and tensions between the two countries worsened during Trump's tenure. But the two countries have released each other's citizens in the past, most recently in June 2020, when the U.S. freed Iranian scientist Mahid Taheri, as Tehran set free U.S. Navy veteran Michael White. Back here in Washington, Vice President Kamala Harris swears in Bill Nelson as the new NASA administrator during a ceremony at the White House. Nelson says it's a new day in space. The White House announced Friday that President Joe Biden was tapping Bill Nelson as his NASA chief. Nelson, a former Democratic senator for Florida, once flew on a space shuttle and helped craft key space legislation. The nomination appears to confirm Biden's interest in maintaining U.S. leadership in space as NASA prepares to return to the moon under the Artemis program while pivoting towards commercial partnerships for missions in low Earth orbit. President Biden has also signaled that climate change research will be a top priority for the agency. Nelson succeeds ex-administrator Jim Bridenstine, who was picked by former President Donald Trump and stepped down on January 20. Bridenstine's own nomination was initially met with deep skepticism as a result of his controversial political positions when he was a Republican member of the House of Representatives, including opposing the scientific consensus on climate change. But he came to be respected as an able NASA administrator, and his experience in Congress proved invaluable in marshaling support for the agency's goals. He also reversed his position on climate. A statement from the White House emphasized Nelson's 4 decades in public office, first in the Florida state legislature and U.S. Congress, then as state treasurer. The 78-year-old moderate Democrat was elected to the Senate 3 times, but lost his last re-election bid. His term ended in 2019. He chaired or was ranking member of space committees in both the House and Senate over his long political career. The White House says most every piece of space and science law has had his imprint, including the 2010 law that set NASA on its present course of both government and private missions. In 1986, he became the second sitting member of Congress to travel to space when he flew on the Space Shuttle Columbia. Nelson, who previously served in the U.S. Army, where he became a captain, helped conduct medical experiments during the space mission. Here's a look at today's COVID-19 numbers. According to the Coronavirus Research Center of Johns Hopkins University and Medicine, as of 6 p.m. Eastern Time, Monday, May 3, 2021, the number of cases of COVID-19 reported worldwide is now over 153,036,000. Top 3 on the list of countries with recorded cases: the United States with more than 32.4 million, India more than 19.9 million, and Brazil with more than 14.7 million. This virus has now claimed more than 3,204,000 lives worldwide. Top 3 countries with the most number of COVID-19 related deaths are the United States with over 577,000, Brazil over 407,000, and India over 218,000. Now for COVID news, 3 Qatar Airways cargo flights carrying 300 tons of medical aid from around the world take off from Doha to India to help fight the coronavirus as its death toll climbed to a grim new record. The country of 1.3 billion reported 3,689 coronavirus deaths, on Sunday, another grim daily record with nearly 400,000 new cases of COVID-19 registered across India. Qatar Airways CEO, as well as the ambassador of India to Qatar, commented on the situation.
This is one of the 3 charter flights fully laden with medical equipment, medicines, and other aid that countries around the world are giving to India during this very dark period of the pandemic that is so violently spreading all over India.
3 flights today which Qatar Airways is flying to India are flying to Bengaluru, Delhi and Mumbai, and is carrying essential medical supplies, including things like oxygen generators, oxygen capacitors, concentrators, CPAPs, and other essential medical supplies. So these are very good and very important requirements at this time for all the Indians and in their fight against COVID. The people of India are looking at this support which comes in, including the essential medical supplies. We have seen mobilization of oxygen concentrators. We have seen mobilization of liquid medical oxygen, the ISO tankers, cryogenic tankers, which have moved around the world to India, as also some ventilators. So these are all mean a lot at this point in time, including medicines like remdesivir and others.
International aid to alleviate India's dire oxygen shortage arrived in the South Asian nation on Sunday as its coronavirus death toll climbed to an alarming new record. Surges in Brazil and Canada have also highlighted the persistent threat of the pandemic, with the global death toll approaching 3.2 million, even as many nations ramp up vaccination drives. India expanded its vaccination program to all adults on Saturday, but many of its states are struggling with shortages despite an export freeze for shots produced domestically. The latest surge in deaths came as medical equipment from abroad, including oxygen generation plants, was flown into the capital of New Delhi as part of a huge international effort. The United States, Russia, and Britain sent emergency supplies, including oxygen generators, face masks, and vaccines. Aid from France reached India on Sunday, including 8 oxygen generator plants and 28 ventilators, adding to the ventilators from Germany that arrived the previous night. A group of British doctors also staged their own intervention by offering long-distance telemedicine from Britain to take the pressure off their Indian colleagues and allow them to concentrate on COVID patients. Anthony Fauci, the top U.S. pandemic advisor, said in comments published Saturday that the whole of India should go into lockdown to fight this wave. A growing list of countries have cut flights from India, with Nigeria on Sunday banning entry to all travelers who have been in the country in the last 2 weeks, though Nigerians and those transiting in India will be exempt. India's total COVID-19 caseload nears 20 million, and oxygen shortages exacerbated a devastating second wave on Monday as the EU proposes new rules that could allow travelers who are fully vaccinated to enter the bloc. Cases have soared by around 8 million since the end of March, with Indian Prime Minister Narendra Modi under growing pressure to take decisive action to reverse the surge. The match between Kolkata Knight Riders and Royal Challengers Bangalore was called off just hours before its start. Amid severe shortages, India's federal and state authorities have been scrambling to get an extra oxygen to hospitals, including by sourcing it from the steel industry and sending special oxygen express trains. When we come back, updates from Pennsylvania and New Jersey. Eagle News America continues.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
'Events
watching Eagle News America. I am Eliza Gonzalez Manglekmot in Washington. $132.5 billion. That's how much of an economic impact Pennsylvania's agriculture industry is making on the state. What does this actually mean? Bureau Chief Myla Simbulan has the answers. Myla?
That's right, Eliza. A new economic impact report was released for Pennsylvania's leading agriculture industry. In coordination with Team Pennsylvania and eConsult Solutions Incorporated, and Governor Tom Wolf made one thing clear: agriculture is fundamental to Pennsylvania's economy. The new report for Pennsylvania agriculture's economic impact shows that the industry has a $132.5 billion annual economic impact and supports more than 590,000 jobs, paying nearly $33 billion in wages annually. The report also makes strategic recommendations intended to help guide Pennsylvania's agriculture industry as it continues to navigate an ever-changing marketplace. Here's Department of Agriculture Secretary Russell Redding. Take a look.
The real impact of agriculture was seen in 2020. It was seen through the community. I can't tell you the number of calls and conversations with the agricultural community wanting to help, right? Wanting to do something. They had their own worries, right? They had tried to figure out what they were going to do themselves. But they also wanted to make a difference in the community. And I can tell you, we can all be thankful and grateful for that industry and their contribution, but also remind ourselves of how blessed we are to have an industry that is both significant for its jobs, but also charitable in so many ways. So this industry of $132.5 billion in Pennsylvania, we commend them for what they do. 590,000+ jobs that are part of that industry, and $33 billion in direct wages paid in agriculture, so significant.
Since the last report was issued in January 2018, Governor Wolf quickly set to work utilizing the recommendations to write a 6-point plan for Pennsylvania agriculture that led to the proposal and funding of the first ever Pennsylvania Farm Bill in 2019. The historic package of comprehensive legislation has since invested $37.2 million into Pennsylvania agriculture. In addition to providing a diverse array of grant programs to meet the needs of the industry identified in the 2018 report, the Pennsylvania Farm Bill included legislation to remove regulatory burdens and provide service support to the industry. In the governor's 2021-2022 budget plan, the Pennsylvania Farm Bill is once again proposed to be funded at $13.6 million. The report includes an in-depth analysis of the 8 major subsectors of Pennsylvania agriculture, including poultry and egg production, dairy production, beef production, other animals including pigs, sheep, and goats, fruit and vegetable production, hardwoods and wood production, nursery, landscaping, and related activities, and food manufacturing. Right now, Eliza, here in Swarthmore, it's warm. It's 63 degrees Fahrenheit or 70 degrees Celsius with rain. In Swarthmore, Pennsylvania, Myla Simbulan, Eagle News, we live in interesting times. Back to you, Eliza.
Thank you, Myla. For the benefit of our viewers, could you explain to us further what the Pennsylvania Farm Bill is all about?
So, like I said, the Pennsylvania Farm Bill is Governor Tom Wolf's baby. It's a bold, aggressive, and it's a necessary investment in Pennsylvania's agriculture so they will grow opportunities and resources, remove those barriers to entry, inspire future generations of leaders within agriculture. This Farm Bill provides support for the Commonwealth's leading industry in 6 funnels, or like what I mentioned, 6 points. So I'll just highlight some of them. It will include Pennsylvania Farm to School Grant Program. It increases nutrition and agriculture education opportunities for pre-kindergarten through 5th grade. And there's also realty transfer tax exemption for the transfer of preserved farmland to a qualified beginning farmer. There's also Pennsylvania Preferred Organic Initiative. This is my favorite, will enhance and grow Pennsylvania's organic sector. So these are just some of the highlights on what's included on the 6-point plan. Eliza?
On Myla, farm to school program, that sounds really promising. Now, Myla, does the recent report that you just told us about, does that include the impact of the COVID-19 pandemic in the state's agriculture?
Yes, it does. It's highlighted in there. It's an important part of the report, and it's a review of future impacts that includes an assessment of the impact of COVID-19 on Pennsylvania agriculture and priorities for recovery. And these impacts highlight a need to focus on building on strengths, addressing weaknesses, seizing opportunities, and confronting those threats that face the industry. Eliza?
You mentioned building of strength. Now, Myla, they say there is strength in numbers. Now, as a consumer, how do you think households in Pennsylvania can help the agriculture industry there as this pandemic lingers on?
I think the best way to support Pennsylvania agriculture as a consumer is support our local farmers by buying local produce. I'm actually excited because I just found out that this coming Saturday, the farmers market here in Swarthmore, it will be opening after closing for more than a year due to the pandemic. It's actually an outdoor farmers market, and there's usually local produce that you can buy, and then there's also breads from local bakeries, even hobbies. You can get jewelries as well. And one of our favorites, especially my kids, is the local ice cream. There's a creamery, local creamery, and you can really taste the difference between the one that you buy at the grocery store and the one that you buy at the local creamery.
Oh, Myla, I see you first in line, Myla. I imagine you riding your bike with a basket full of vegetables.
That's right. Yeah, we usually ride our bike because it's really close by, or we walk if we don't feel like using our bikes. But yes, we're
save that for a round table, Myla.
Exactly, yes.
Thank you. Now, in the state of New Jersey, more pandemic restrictions are being lifted. In Sicklerville, EBC's Mayan Manzano-Guerzon tells us which ones. Mayan?
Thank you, Eliza. In a report from the Office of Governor Phil Murphy, today, the governor announced an additional easing of restrictions, including a removal of all percentage capacity limits for indoor and outdoor businesses, a lifting of the prohibition on indoor bar seating, and an end to the outdoor gathering limit. These changes will take effect on Friday, May 7, although some of which were previously scheduled to take effect on Monday, May 10. Take a look.
I'm signing an executive order today, moving up the effective date of the reopening steps that we announced last Monday, which were to have taken effect 1 week from today on May 10th. They are all moved up to this Friday, May 7th. As a reminder, these included the increasing of the outdoor gathering limits to 500 individuals, increase indoor room capacities to 50%, up to 250 individuals for political gatherings, weddings, funerals, memorial services, and performances. Reopening dance floors at private catered events. That includes proms, and for those of you who are having your prom this weekend, let it be said that we heard you. Increasing capacities at large outdoor stadiums and venues with more than 1,000 seats, up to 50% capacity, and other steps. We feel confident in moving up this timetable by 3 days, given the accelerated progress we are seeing in our vaccination program and hospital metrics and lower daily case counts. Additionally, effective this Friday, we will lift the prohibition on indoor bar-side seating. The Department of Health is currently finalizing its guidance, but all impacted restaurant, tavern, and bar owners should be prepared to ensure proper social distancing between patrons at their bars, either the CDC's 6-foot requirement or physical partitions. We are counting on restaurants and bar owners to enforce this guidance and prevent congregating at the bar, as we have warned all along that those situations present a higher danger of allowing the virus to spread. And also effective this Friday, We will lift the prohibition on buffets and other self-service foods at restaurants. Again, full guidance is being finalized, but we will likely maintain the current limitations requiring food and drinks to be consumed while seated. Additionally, if you're not seated at your table while eating or drinking, you'll continue to be required to wear a mask. As I noted last week, we have been fully expecting to be able to take additional steps to relax regulations as more people are vaccinated and the weather warms up. And so long as all the vital metrics keep moving in the right directions.
The full text of the executive order is available at nja.gov. And for New Jersey's latest COVID-19 numbers, the Department of Health has reported another 880 new positive cases today, bringing our statewide total to 876,141. Sadly, we are also reporting 16 new confirmed deaths, pushing the total to 22,991 fatalities. But on the brighter side, the latest total of fully vaccinated people in New Jersey is now more than 3,250,000. To know the latest on New Jersey's vaccination progress, visit covid19.nj.gov/vaccine. And Eliza, for a quick weather update, it's currently 10 in the evening here in New Jersey, and it's currently cloudy. It is 64 degrees Fahrenheit or 18 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News, we live in interesting times. Back to you, Eliza.
Now, Mayan, could you tell us what triggered the easing of more restrictions in the state?
Well, Eliza, as mentioned by Governor Murphy in the COVID briefing earlier today, it's our numbers because they thankfully continued to go down. So the state's 7-day average for new confirmed positive COVID-19 tests dropped to 1,561. So it's down 32% from a week ago and 61% from a month ago. Also, statewide COVID-19 hospitalizations continue to fall below 1,400, while the statewide rate of transmission dropped again to 37. Eliza?
Now, Mayan, with all these restrictions being lifted, are there anything else left in New Jersey's COVID rules?
Well, a lot.
Oh, okay.
Eliza, so after May 19, New Jersey's remaining restrictions will include 6-foot social distancing and masks, of course, required inside businesses, including at bars and restaurants. And for restaurants, tables may be closer than 6 feet if physical barriers are used, but people must remain seated at bars and restaurants and wear masks whenever they're not eating or drinking. Masks are still required inside and outdoors when people can't socially distance, including at outdoor events like parades, fireworks, and fairs. And also capacity limits on inside catered events are capped at 250 people. Large outdoor stadiums are capped at 50% capacity. Any venue that has 1,000 or more seats is considered large. And the capacity limit for large indoor venues will increase to 30%, up from 20%. And definition for large will change to 1,000 to match outdoor venues. And the private indoor gatherings are capped at 50 people, and youth, day, and sleepaway camps have about a dozen guidelines they're required to follow this summer. So we still have a lot, Eliza, but this lifting of restrictions, of course, that was announced today is already a big move for the reopening of New Jersey. Eliza.
Slowly but surely, still a lot, but we'll get there. Thank you, Mayan.
Thank you, Eliza.
Now, here in the nation's capital, local businesses are encouraged to apply for the Restaurant Revitalization Fund in an effort to boost the industry impacted by the pandemic. The district is also urging its residents to buy local as DC's economy recovers. Eagle News correspondent Rose Papa Angeles with the details.
Thank you. Ahead of National Small Business Week, Mayor Muriel Bowser of Washington, D.C. encourages local small business owners to apply for the Restaurant Revitalization Fund. This relief program, operated by the U.S. Small Business Administration, will provide emergency assistance for eligible restaurants, food trucks, and other qualifying business impacted by the COVID-19 pandemic. Registration for the SBA application portal began Friday, and applications open today, May 3rd at noon. Recipients are not required to repay the funding as long as funds are used for eligible uses no later than March 11, 2023. More information, including eligibility guidelines and application details, can be found on dc.gov. The Restaurant Revitalization Fund, established by the American Rescue Plan Act, will provide restaurants with funding equal to their pandemic-related revenue loss, up to $10 million per business, and no more than $5 million per physical location. Mayor Bowser also urges residents to continue supporting small and local businesses as the district continues its economic recovery efforts. Residents can do this by participating in the hashtag IBuyDC challenge. It is a citywide campaign to support and promote district businesses. This campaign allows residents and businesses to showcase how they support the local economy every day while highlighting local businesses they love to visit and inspiring friends and family to do the same. Residents can also support local entrepreneurs by visiting Shop in the District, a website that provides a comprehensive guide to local retailer. Each of these retailers features a curated list of unique gifts reflective of the diverse DC community. Since the COVID-19 public health emergency began in March last year, the district has made available more than $150 million to support small and local businesses and nonprofits through various funding opportunities. These include the Bridge Fund DC Small Business Microgrant Program, the Ward 7 and 8 Microgrant Program, the Small Business Resiliency Fund, DC Child Care Provider Relief Fund, the Legacy Business Supplemental Microgrant Program, and the Streetery Winter Ready Grant Program. In Washington, D.C., Rose Papa Angeles, Eagle News. We live in interesting times. Back to you.
Thank you, Rose. Still to come, stories from Maryland, Nevada, and California. This is Eagle News America. Stay with us.
Innovation, digital disruption, globalization. Startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges in the market today. Peek into the world of exciting opportunities and partnerships to drive growth with the latest business news and information. We are open for business. Your weekly dose of entrepreneurial inspiration to update you on the latest developments in the world of business. Get up close and personal with CEOs and thought leaders to help you discover valuable insights, sharpen your instincts for smart decision making with the latest markets and economic trends, disruptive ideas, global innovation, social entrepreneurship, and other leading-edge business ideas. Join the conversations to create a more vibrant environment for entrepreneurship. Catch Open for Business, from vision to action.
This is Eagle News America. I'm Eliza Gonzalez Manglakmot in Washington. In the neighboring state of Maryland, several pandemic restrictions have been lifted, and drive-thru, no-appointment COVID vaccinations are now being offered. In Fort Washington, we have Arlene Ocampo with the update. Arlene?
Thank you, Eliza. With key health metrics consistently improving and the vaccinations being given, Maryland Governor Larry Hogan announced the lifting of some restrictions. Hogan said that there will be additional measurements implemented in the weeks to come to return to a sense of normalcy. Here are the updated health metrics as of today. The state of Maryland is at phase 3 with 2,123,711 Marylanders being fully vaccinated. Currently, there are 953 hospitalized, and the positivity rate is at 3.69%. One of the restrictions that was lifted here in the state of Maryland is the outdoor mask mandate. Face coverings and masks are no longer required while outdoors, except if you are in a large ticketed venue. This mandate is in line with the new CDC guidelines. Public and private business indoors still require the face coverings and when using public transportation. Marylanders who are not yet vaccinated are strongly encouraged to continue wearing face masks, especially when social distancing is not possible. Another restriction that was lifted is in regards to outdoor dining. Standing service resumed at restaurants, and all restrictions related to outdoor dining capacity and social distancing have been lifted. Seated service and physical distancing requirements will remain in place for indoor dining. Meanwhile, Marylanders have additional options in obtaining the vaccine. 3 of the mass vaccination sites are now welcoming drive-thru, no appointments at their sites. This includes Ripken Stadium, Regency Furniture Stadium, and at Six Flags America. The other 6 vaccination sites will continue accommodating walk-up no appointments, which include the following locations: the Hagerstown Premium Outlets, Navy Marine Corps Memorial Stadium, the Baltimore Convention Center, M&T Bank Stadium, Greenbelt Metro Station, and the Wicomico Youth and Civic Center. All of these locations are offering the Pfizer vaccine, except for the Navy Marine Corps Memorial Stadium. They will be offering Moderna. Governor Hogan mentioned that the fastest way to put this pandemic behind us is to have every single Marylander vaccinated as soon as possible. In Fort Washington, Maryland, Arlene Ocampo, Eagle News, we live in interesting times. Back to you, Eliza.
Thank you, Arlene. Now, Arlene, there is another option with regards to scheduling an appointment at the mass vaccination sites. Tell us about this one.
Yes, thank you. So previously, with the mass vaccination sites, one had to actually pre-register, and then they would actually contact you once there was an availability. But now, as I've mentioned, there are some walk-up options, drive-through options with no appointments. With these, there may be a wait time, and there's also no guarantee that you will be receiving the vaccine. But this new option that they have now allows you to directly schedule for one to receive the vaccine at any of the mass vaccination sites. So those that are actually interested, you would just visit the covidvax.maryland.gov website, or you can call by phone through the state's COVID-19 Vaccination Support Center at 1-855-MD-GOVAX or 1-855-634-6829, and that's from 7 a.m. up to 10 p.m. in the evening. Eliza?
Now, Arlene, there is an incentive if a state employee gets the vaccine. Do you have any information on this?
Yes, so today, Governor Hogan announced that the state of Maryland will offer a $100 incentive to state employees who actually receive the vaccine. To receive this, the employees must provide their human resource office, with proof that they actually got the vaccine. They'll also have to agree to receive all subsequent CDC recommended booster vaccinations within 18 months of being fully vaccinated. The incentive is retroactive, so if you've already been fully vaccinated, you would also still receive the $100 incentive payment. But those who refuse after receiving the vaccination incentive, if they refuse to do the booster, then they have to actually repay the state the $100 for failure to adhere to the actual agreement. Eliza?
Okay, that's tough. Now, you mentioned earlier drive-through vaccination sites. I wonder if bikes are included on those. Thank you for your report, Arlene.
Thank you, Eliza.
In Nevada, North Las Vegas is ramping up efforts to reach unvaccinated communities as the state prepares for 100% reopening. Bureau Chief Anna Cui is with us tonight with the details. Anna?
Thank you, Eliza. Yes, according to health officials from the Southern Nevada Health District, several North Las Vegas neighborhoods are considered under-vaccinated, where several of the zip codes in the area are recording less than 6,000 doses administered. So as you know, we've reported recently that there's been an ease of restrictions here in Las Vegas. We've had an increase of capacity limit to 80% and social distancing reduced to 3 feet from 6 feet as of Saturday, just 2 days ago. And the goal still stands to fully reopen by June 1, provided that the vaccination rate in Clark County, which includes North Las Vegas and Las Vegas, reaches 60% of the population. Well, Eliza, it's not looking very promising now, since there's been a steady decline in daily vaccination administered based on a 14-day rolling average, which is down over 40% since April 15. We're talking about, it was averaging about 25,000 daily dose administered to about 14,000 now as of Sunday. Part of the reason specific to North Las Vegas, and I think we can say that for the whole city, is really access, according to community leaders. So, some of them may not have transportation to get to the mass vaccination sites. And that's why one of the major sites, was closed about a month ago, and they've concentrated on the smaller vaccination sites. So they've pushed to target these areas. I mean, they've provided bilingual, phone call outreach, bilingual emails to residents, bilingual public service announcements that they played, at local radio stations. They've had people, at local grocery stores encouraging people to get vaccinated. They've even created pop-up clinics throughout the valley. So, and for those I mentioned earlier, trouble with transportation, the city also has in-home vaccinations for the homebound, and they've partnered with Lyft to give free rides to appointments for those who really need it. All they have to do is call the 800-401-0946, and they can get all that information. These efforts have helped more recently, just these recent days, and officials report that 85,000 residents of North Las Vegas have received at least one dose. Their total population is, according to officials, is just over 241,000. Currently, right now in Clark County, over 45% of those 16 years and older have received one dose, and over 33% of the same population group has been fully vaccinated with the COVID vaccine. Now, Eliza, before I let you go, I have a quick weather update. It was very nice today, very mild in the entertainment capital of the world. It was sunny and just a little bit windy. Currently, we are at 78 degrees Fahrenheit or 25 degrees Celsius. In Las Vegas, Anna Kui, Eagle News, we live in interesting times. Back to you, Liza.
Thank you, Anna. 78, that is lovely. Now, Anna, you mentioned the daily decline in vaccinations, but I heard officials there are really, really trying to encourage the rest of the community to get vaccinated. Now, Anna, could you tell us some of the other strategies that they're using, aside from, like what you've mentioned, free rides to the sites?
Right? I mean, that's a big help. Some of the incentives, they've actually just more recently, they've given gift cards and concert raffle tickets as a little push, a little more push for encouragement. Now I have to look now if there's anyone giving cash, like Arlene had mentioned there. $100 is a lot of money, right? For some families. So I'm going to have to look to see if anyone is giving out cash as well. The concert was not specified, but I'm sure everybody's excited that everything is opening up, so they're going to take advantage of that. But more so, the thing that they're encouraging through their messaging here, Eliza, is something that money can't buy. They're selling it to where if you're fully vaccinated, you can do more with your families and with your friends, create new memories, and get some of that lost time with your loved ones. So that should be effective, Eliza.
I hope so, Anna. Now, with the easing of restrictions and based on your observations, do you think that's playing a positive part in encouraging people to get vaccinated?
I really think it depends on on who I've asked, I find that in the younger population, those in their 20s, early 30s, they're stuck. Especially the women, they're stuck with what happened with the Johnson & Johnson vaccine recently, and they really tend to focus on the negative noise, from social media. Some even have that mentality that, since we're opening, it must be okay now. So, we just have to continue to encourage them. Liza.
Well, thank you, Anna, for your report. Now let's head over to California. Los Angeles will soon stop its mass COVID-19 vaccination site at Dodger Stadium. While this may seem like bad news to some, it's actually a good development in LA's fight against the coronavirus. ABC LA correspondent AJ Reyututar tells us why. AJ?
Thank you, Eliza. So Los Angeles transitions to focus more on walk-up mobile clinics and centers for the COVID-19 vaccinations with appointment-free options as the city prepares to cease vaccine operations at the Dodger Stadium location by the end of this month. The city will still continue their efforts to make the vaccines accessible to the communities in Los Angeles in a safe and effective way as it moves from mass vaccination sites to being more community-based with the mobile clinics and pop-up centers. Los Angeles Mayor Eric Garcetti states, Dodger Stadium set the standard for sports franchises and community institutions, playing a starring role in our COVID-19 response for the country. As we enter the next phase in our vaccination program, with the continued support of our dedicated partners, CORE, LAFD, Carbon Health, USC School of Pharmacy, Curative, and the County Department of Public Health, our city is prepared to bring doses to Angelenos and move us closer to the end of this pandemic. Dodger Stadium is one of the city's 5 massive vaccination centers that opened to Angelenos at the beginning of this year. And now, it will come to a close by the end of May, completing its purpose in serving the city of Los Angeles, administering more than 420,000 COVID-19 vaccines at this specific location. To date, there has been around 1,168,559 vaccine doses administered at the city's 10 established vaccination sites since December of last year, accounting for 94% of the city's supply. Stan Kasten, Dodger president and CEO, says Dodger Stadium is part of the fabric of Los Angeles, and for the past year, it has been so much more than just a ballpark. We're extraordinarily proud to have played a role in Los Angeles' response to COVID-19, hosting one of the largest testing and vaccination sites in the country, and to have served as a vote center, which allowed thousands of Angelenos to vote safely outdoors. From day one, we told the mayor, we're here to help in any way we can, and that offer will continue to stand long after the last vaccine dose has been administered in our parking lot. In Panorama City, California, AJ Reyututar, Eagle News. We live in interesting times. Back to you, Eliza.
Thank you very much, AJ. Now, AJ, what is one of the main reasons behind the city transitioning now to a more community-based operation for the COVID-19 vaccinations, like what you've mentioned, mobile clinics and pop-up centers?
Eliza, so it's actually the next logical step in moving forward in the pandemic for Los Angeles. Mm-hmm. Current statistics in Los Angeles show that 50% of all eligible Angelenos have been administered one dose of the vaccine and 30% have been fully vaccinated. With around 10 million population in Los Angeles County, which includes the 4 million of them residing in the city of Los Angeles, the city as well as the county of Los Angeles needs to reach out more to the people, especially in the most vulnerable areas and places where the vaccine may not be as accessible to Angelenos there. What better way to go out to the community and hold them in locations like community centers, parks, and even churches? It's the collaborative efforts of everyone to make this virus go away for good. Eliza?
Well, thank you very much, AJ, for that report. Now, up next, tonight's roundtable on stories of biking around our neighborhoods for National Bike Month. You're watching Eagle News America. Welcome back. You are watching Eagle News America. May is National Bike Month. Now, according to Healthline.com, cycling, a low-impact aerobic exercise that offers a wealth of benefits, is a wonderful workout that keeps you active. Now, bike riding can help shape a healthy lifestyle, both physically and mentally. Biking, as it varies in intensity, makes an activity suitable for all levels. Now, aside from cycling as a mode of transport, it is also a beneficial casual activity and even an intense competitive endeavor. Now, it is time for our roundtable. We will ask our team bike stories. Okay, we'll start with AJ. AJ, could you share with us when did you get your first bike? Describe to us how it looks, and if you still bike now, why do you bike? Do you bike to go to work or just for a casual activity? AJ?
Eliza, so my first bike, I think I was 10 years old. I saw it at my older cousin's house. I thought it was so cool. It was yellow, it was a mountain bike. But they still needed to fix it up. So once they fixed it up, me and my dad went out to Rosemead to pick it up, stuffed it in the small sedan, and the first thing we did was go to the park and just ride around. So it was pretty cool. I don't currently ride actually, I still ride, but it's a standing bike. I just do it to warm up before I work out. But other than that, no actual biking. Yeah.
Oh, who taught you to ride one?
My dad, actually, yeah, when I was pretty young, yeah.
All right. Now let's move on to Arlene. Arlene, tell us, bike stories.
Okay, I got my first bike when I was about 5 years old.
Wow, really?
Yes. It was a hot pink and white bike with the basket in the front. My dad taught me how to ride that bike. We lived on military base. So I would just kind of, ride it around the carport and stuff. But as I got older, obviously I got another bike. And that was my mode of transportation, especially like you're on base and we wanted to go everywhere. As long as we had our military ID on us, my dad was fine with me just, going everywhere on base. So during the summer, I would transport myself to the swimming pool every summer.
Wow.
Yeah, so that's how I got around, and then make stops at the bowling alley, go bowling and stuff like that. So back in the younger days, I don't bike anymore.
Why not? Let me ask you, did you used to wear a helmet?
I did, yes.
Okay. You have to, huh? You had to.
Yes, I did.
Okay, let's now move on to Mayanne. Bike stories, Mayanne.
Well, Eliza, I never owned a bike. I don't bike anymore, and I don't have any bike stories because I never learned how to ride a bike, unfortunately. So happy National Bike Month to all bikers. I now pass the floor to Myla.
Okay, Myla, tell us about your bike to market experience.
I have a problem, Eliza. I could not remember if I ever had a bike when I was a kid. I think I was already in high school when I learned how to bike. I think a friend of mine taught me how to ride a bike. So I can't really remember. I don't even remember my parents, teaching me how to bike. So, I think it was in high school when I learned how to bike, because whenever we buy a new bike for my kids, for them to learn, you have to show it to them. And I think, I know how to bike, but I could not really remember up to this moment. I'm still trying to figure out, when did I learn how to bike? But I don't bike, but then every time my kids have to go biking, as long as the road is flat, I'm good with that. But when it comes to those bumpy roads, no, I'm afraid of those parts of the road. So That's the extent of my biking story.
Do your 3 kids have one each?
Yes, they do. Well, actually, yeah, they do. But they, from my daughter, it goes to my son, and from my son to my youngest. They share the bike. They don't own it themselves because how fast they grow. So they move from one kid to another.
It's handed down, huh?
Yes, yes.
How about you, AJ? You have how many? 3 brothers. Did you guys have one each, or did your bike got handed down to the next?
I believe we had our own bikes. Yeah, I think we only had them until until Aaron. he only learned how to ride a bike on training wheels. I don't think he ever learned how to ride a bike without the training wheels. Yeah.
Okay. Now, Arlene, do your 2 boys have one each?
They don't ride bikes.
They don't?
I think that they did when they were younger, but now they don't. No, they just like to play sports. They like to play basketball.
They prefer scooters.
Photographers, yeah.
Okay, let's now head over to Las Vegas. Anna, bike stories.
Hi, Eliza. So I grew up in the Philippines with, I want to say 6, 7 cousins.
Wow.
So we lived in the same compound, like 3 different houses. So I grew up with them. So it was a shared bike. I don't think I had my own bike now that I'm thinking about it. So I learned, my cousins taught me. So I can't remember it was just a plain bike. And like I said, we shared it and I rode it in the neighborhood. So I think the last time I rode a bike was when I was maybe 10 years old. But my kids, I have 2 boys and a girl. So my 2 boys did grow up with a bike, and I remember they would use that to pick up their sister from school. And one story that discourages me from them riding bikes, they're all bigger now, but my eldest, he broke his arm riding it was mountain biking. So I didn't know that they went to a place where they actually make those big jumps, mountain biking. So
that made you nervous, I'm sure, and mad.
Yes.
Speaking of mountain biking, Anna, our producer Kathleen will be sharing with us a story for National Bike Month this week about a group of bikers who go to national parks to bike and hike. So we'll watch out for that.
Interesting. Yes, looking forward to that.
Now it's time to end our program, but before we do, we salute our frontliners, first responders, and essential workers with a round of applause. Thank you for being our heroes. And that is today's Eagle News America. Thank you for joining us. I am Eliza Gonzalez Manglikmot. We live in interesting times.